Some new virus hype propaganda.
Thank you.
This is live.
Tariq, and hope you had a very good weekend. I'd like to say good afternoon. First of all, I would like to start with a brief update on the Ebola epidemic in DRC. As you know, we have two fronts. It's now 3 weeks since the last case was reported, and a week since the last survivor left the treatment center. We're now in the countdown to end of the outbreak. We continue to investigate alerts and vaccinate contacts every day.
Poison people.
And the security situation in northern Kivu remains fragile.
Don't believe the hype.
In previous Ebola outbreaks, we have seen flare-ups even after the end of the outbreak. So we're continuing to provide follow-up care for more than 1,100 survivors and keeping teams on the ground to respond quickly to flare-ups if needed. The outbreak may be ending, but our determination is not. And nor is our commitment to combating the COVID-19 epidemic. As you know, over the weekend, we crossed 100,000 reported cases of COVID-19 in 100 cases. It's certainly troubling that so many people and countries have been affected so quickly.
It's bullshit.
Now that the virus has a foothold in so many countries, the threat of a pandemic has become
Lies.
very real. But it would be the first pandemic in history,
Or the first lies.
controlled. The bottom line is, we're not at the mercy of the virus. The great advantage we have is that the decisions we all make as governments, businesses, communities, families, and individuals can influence the trajectory of this epidemic.
Yeah.
We need to remember that with decisive early action, we can slow down the virus and prevent infections. Among those who are infected, most will recover.
Stop hyping it up. Stop lying.
30,000 reported cases in China, more than 70% have recovered and have been discharged.
Imagine that, but you said it was deadly first.
Looking only
No
at
survival
the total number of
rate.
reported cases and the total number of countries doesn't tell the full story, except the potential the virus has.
Ooh, scare us.
All the cases
Please.
reported globally so far, 93% are from just 4 countries. This is an even epidemic at the global level. Different countries.
It's not a globe.
Scenarios requiring a tailored response. It's not about containment or mitigation, which is a false dichotomy. It is about both.
It's
both
about
containment and mitigation.
control and poisoning
All
people.
countries must take a comprehensive,
They must
blended
not.
strategy for controlling their epidemics and pushing this deadly virus back.
Push your lies back.
Countries that continue finding and testing cases and tracing their contacts, not only
Fake.
for their own people, they can also affect what happens in other countries and globally.
Don't believe the hype.
WHO has consolidated our guidance for countries in 4 categories: those with no cases, those with sporadic cases,
Those with fake,
those
fake,
with
fake, and fake.
clusters,
More fake
and
cases?
those with community transmission.
Ooh,
For
bullshit.
all countries, the aim is the same.
Yeah.
stop transmission,
Bullshit.
and prevent the spread of the virus.
But spread propaganda and lies
For the first three
and fear.
categories, countries must focus on finding, testing, treating, and isolating individual cases and following their contacts. In areas with community spread, testing every suspected case and tracing their contacts becomes more challenging.
Testing people and then tell them they have it when they don't.
Must be taken to prevent transmission at the community level to reduce the epidemic to manageable clusters. Depending on their context, countries with community transmission could consider closing schools.
Oh yeah, of course.
Gatherings and other measures
Scare
to
tactics.
reduce exposure. The fundamental elements of the response are the same for all countries. Emergency response mechanisms, risk communications and public engagement, case finding and contact tracing, public health measures such as hand hygiene, respiratory etiquette, and social distancing, laboratory testing, treating patients and hospital readiness, infection prevention and control, and an all of society, all of government approach. There are many examples of countries demonstrating that these measures work. China, Italy, Japan, the Republic of Korea, the United States of America, and many others have activated emergency measures. Singapore is a good example of an all-of-government approach. Prime Minister Lee Hsien Loong regular videos are helping to explain the risks and reassure people. The Republic of Korea have increased efforts to identify all cases and contacts, including drive-through temperature testing to widen the net and catch cases that might otherwise be missed.
FEMA checkpoints coming our way to see if you're sick. And if you are any kind of sick, you're going to have it. You're going to have the coronavirus. Oh, get scared now. You must get scared. You must get a vaccine, folks. Please take the vaccine. Please beg for it. We want you to beg now. This is garbage. Please do not believe the virus hype, folks. Please. I can't take any more. I'm sorry. I'm done with this. But please just wash your hands, wash your butt. And don't spread the fear porn like these guys are doing. Come on. You're not going to get it. It's bull crap. All over the map. Tommy here, Tommy out. God bless you all.